Good morning for our module for Specimen Collection. This will be the module. So let's start with pre-analytical variables. So factors that affect specimen before they are performed. So kapag pre-analytical, bago magkaroon ng testing or ng pag-run or processing ng ating specimens. So most common cause of error is mislabeling. So mali yung pangalan. Dapat laging tama yung pangalan. Tama doon sa barcode if may barcode system kayo sa laboratory para alam nyo kung kanino yung specimen na yun. Kasi magkaiba din yung MA sa Maria na buo. Dapat kung ano talaga yung kanyang nasa ID or nasa birth certificate, dapat tama yung pangalan. Una-una yun, mislabeling. Mali yung pangalan na nailagay doon sa tube. So pre-analytical variables, number 1 is exercise. So, exercise causes the following. So, volume shifting between intravascular sa loob and extravascular compartment, palabas ng ugat. So, volume loss through sweating and hormonal changes. Yun yung pag nag-exercise mismo. Yung mga jogging, gym, ito yung mga nangyayari. Nagkakaroon ng variation. Increase in the following. So, transient increase in LDH, fatty acid, and ammonia. Long-term, creatine kinase. So, ito ay enzyme sa nakikita sa muscle. Aspartate aminotransferase and aldolase. So, ganun din. Sa muscle din nakikita. Proteins in urine kasi nagbe-breakdown yung protein kapag nag-gym ka or nag-exercise ng vigorous. So, nagkakaroon ng protein. Then, vigorous hand exercise or yung fist clenching, yung pag-close open ng kamay habang naka-tourniquet. Hindi dapat nakaganon. Hindi pwede yun sa atin. So, pwede yun pag nagsuswero. Pero pag sa atin mag-extract ng dugo, hindi pwedeng nag-fist clenching or nagko-close open. So, nataas kasi yung potassium, lactate, and phosphate. So, kapag ganon, nakita nyo nag-close open, tanggalin nyo yung tourniquet, sabihin nyo, wag na pong igalaw yung kamay. Kailangan nakasarado lang po. Fasting. So, meron tayong mga tests na required ang fasting. For example, FBS, glucose tolerance test, lipid profile, gastrin, and insulin. May tamang fasting dapat para dyan. So, FBS is 6 to 8 hours. Lipid profile is 12 to 14 hours. So, minsan kapag sabay na mayroong FBS lipid sa halip na 2 beses tusukan, yung iba ang ginagawa is 10 hours fasting kapag may FBS at lipid profile para isang tusok na lang. Over fasting causes kapag sobra-sobra na, increased serum bilirubin kapag 48 hours ng fasting, increased plasma triglycerides 72 hours, and increased plasma glucose. So, bakit tumaas pa siya since wala na kinakain? So, posibleng tumaas ito kasi nagbe-breakdown na yung body mo to provide energy or nutrition para sa iyong katawan. So, di ba yung ating gluconeogenesis? Nagagawa na siya ng sarili niyang energy or fuel kasi wala kang ini-intake. So, gagawa niya na ang sarili niya. Next, basal state collection. So, blood is collected early in the morning, 12 hours after the last ingestion of food. So, para siyang yung zero state or parang fasting state. So, diet. High protein diet increases urea. So, urea kasi is byproduct sa ating protein cycle or system. Low carbohydrate, increased ketone in the urine. Kapag mababa yung carbs mo, nagkakaroon ka ng ketone sa urine. Caffeine, or yung kape. Yung caffeine pala, hindi yung kape lang. Yung nasa kape. Increased glucose and catecholamines. Increased fat. So, increased potassium, triglycerides, and 5-HIAA. So, hydroxy indole acetic acid. Position. So, ang preferred position natin kapag kukunan ng dugo is upright or supine. Ideally, the patient must be supine or seated for at least 15 to 20 minutes before blood extraction to prevent hemodilution or hemoconcentration. So, depende kung anong shifting yung nagawa sa position kung magiging hemodilution or hemoconcentration. So, dapat kasi seated na siya 15 to 20 minutes. So, hindi naman natin magagawa yun sa laboratory na paupo na muna for 15 minutes. Pero, nakaupo naman sila sa labas ng mga 15 minutes na before or habang nag-iintay sila ay makunan ng dugo. Next, yung mga nakahiga o yung mga nasa kama na yung kukunan mo ng dugo sa ward. Pag nakahiga na sila, huwag nyo nang pabangunin. Sabihin nyo, higa na lang po para mas stable din yung pagpatong ng kamay. Next is supine to sitting position. So from supine, nakahiga, papunta sa sitting position. Constriction of blood vessels resulting to reduce plasma volume. So hemoconcentration. Nabawasan kasi yung plasma volume kasi nag-constrict yung blood vessels. Hemoconcentration. Affected ang albumin, enzymes, and calcium. Hemoconcentration, ibig sabihin, tumaas yung concentrations ng albumin, enzymes, and calcium. Sitting to supine. So, nakaupo, biglang humiga. Water and electrolytes shift into tissue, hemoconcentration din. So, affected ang proteins, lipids, BUN, iron, and calcium, hemoconcentration, nataas. Hemodilution, nababa. Next is standing to supine. So, nakatayo, humiga. Extravascular water to transfer to the vascular system. So, nasa labas, pumasok sa loob yung kanyang water. So, from the outside the veins, pumasok siya sa loob. Hemodilution or bababa ang cholesterol, triglycerides, and lipoproteins. Tourniquet or tourniquet applications. So, tourniquet, alam naman natin yan, must be applied no longer than 1 minute. Prolonged tourniquet applications results to hemoconcentration, tumataas ang levels ng potassium, protein, enzymes, lactate, cholesterol, and ammonia, and anaerobiasis. So, sa air siya nagkakaproblem. It should not be applied for ammonia determination. So, kapag ammonia determination or ammonia itetest mo, walang tourniquet. Pwede ba mag-extract na walang tourniquet? Pwede. Basta kita mo or alam mo kung nasaan yung ugat. So, abangan mo na lang yung backflow kasi baka hindi siya mag-backflow. So, anticipate mo pag feeling mo nasa ugat ka na, ihigitin mo yung plunger, makikita mo magkaka-backflow na yan kung nasa ugat ka. Tobacco, smoking, or nicotine. So, increased plasma catecholamines and cortisol. Increased in glucose, growth hormone, cholesterol, triglycerides, ammonia, urea lactate, insulin, and urinary 5-IHAA. Neutrophils and monocytes. So, for ammonia determination, pag ammonia ulit ay testing, patient and phlebotomists are not allowed to smoke. So, bawal sila. Decreased levels of vitamin B12. So, nababa ang levels ng vitamin B12 kapag nagtatabako or nag-smoke. Alcohol intake. So, alcohol increases the following: urates, triglycerides, gamma-glutamyltransferase. So, gamma-glutamyltransferase is an enzyme. It is usually associated with the liver. So, alcohol intake also causes hypoglycemia. Kapag chronic alcoholism, nababa yung sugar. Stress or anxiety affects adrenal hormone secretion, yung ating hormones. Increase the following: catecholamines, cortisol, ACTH, prolactin, insulin, albumin, glucose, and lactate. So, total cholesterol has been reported to increase with mild stress, and HDL cholesterol to decrease by as much as 15%. So, yung cholesterol kasi nataas yan. So, nataas daw siya kapag mild stress ka. Yung HDL cholesterol naman, ito yung good cholesterol. Usually 40. Kapag 40 yung measurement or yung ano mo dito, yung nabilang sa'yo, good yun or protective pa siya sa heart. 40 to 60 yata yun. So, kailangan 40 to 60 yung iyong cholesterol. If not, or mas mababa doon, hindi siya protective for heart attack. So, prone ka magka-heart attack. It is also result in hyperventilation, which in turn affects acid-base balance. So, acid-base balance will be tackled at your CC2. Drugs. So, hindi naman drugs lang yung tinutukoy dito. So, medications affecting plasma volume can affect protein, BUN, iron, and calcium concentrations. So, depende kung ano yung ini-intake mo. Mga monitoring, meron ka anticoagulants. So, depende. Therapeutic drug monitoring. So, TDM. Specimen collection should be according to the time of the last dose. So, meron tayo mga gamot, halimbawa barbiturates, na inoorasan kung kailan makukunan. Kung after yun ng last dose ba, kung peak or kung kailan dapat kunan. Meron yung time kung kailan. Hepatotoxic drugs can elevate liver function enzymes. So, hepatotoxic, ibig sabihin yung drugs na nakakasira or nakaka-affect sa ating liver. So, liver function enzymes are AST, ALT, and alkaline phosphatase. So, yung mga enzymes natin. More on that on your second chemistry. Okay, physiological variation. So, this refers to the changes that occur within the body, such as cyclic changes, yung diurnal or circadian rhythm natin, or those resulting from exercise, diet, stress, gender, age, drugs, posture, and underlying medical conditions. So, halos yung inauna din, pero may mga dagdag. Diurnal variations, pag diurnal, day and night. So, ibig sabihin nito, increased in AM, mataas ang ACTH, ang ating adenocorticotrophic hormone, ACTH, aldosterone, cortisol, and iron. So, kapag hapon naman, increased ang ACP, acid phosphatase, growth hormone, parathyroid hormone, and thyroid-stimulating hormone. Next, affected by age or increased levels, albumin, alkaline phosphatase, cholesterol, and phosphorus. So, nataas siya with accordance to age. Affected by gender, so increased levels, so mas mataas kapag sa male ang albumin, alkaline phosphatase, creatinine, uric acid, cholesterol, and BUN. Sa females naman, mataas ang HDL, iron, and cholesterol, so mga fat. Affected by food ingestion, so increased levels, so kapag bagong kain or kumain, meron taas na glucose, triglycerides, gastrin, and free calcium. So decreased levels, nababa naman ang electrolytes like chloride, potassium, and phosphorus, alkaline phosphatase, and amylase. So, itong dalawa ay enzyme. Types of blood specimen. So, alam nyo na to ha. So, venous blood obtained by venipuncture. So, siya ay deoxygenated blood or walang oxygen. Contains products of metabolic activities of different organs. Specimen of choice for most chemistry tests. So, siya kasi yung pinakamadaling obtained na blood sa ating veins lang kukuha. So, the venous blood can be divided or separated. So, plasma kapag liquid portion of anticoagulated blood. So, kapag yung blood mo is may anticoagulant like from the EDTA, EDTA, or the lavender tap, or from the citrated tubes like blue tap. Serum naman is the liquid portion of clotted blood pag may clot enhancers tayo or clotting factors like red tap and the yellow tap. So, adequate time for clotting must be allowed to prevent latent fibrin formation, which may cause clogging in automated chemistry analyzers. So, bago mo i-centrifuge ang sample, dapat full na yung clot niya, nag-retract na or kita mo, clotted na talaga yung specimen, yung naghihiwalay na yung kanyang plasma, ay yung kanyang serum dun sa kanyang red cells. Usually, kapag yellow tap, tapos in-invert mo, yung may gel separator, yung kita nyo may gel sa ilalim. Pag in-invert nyo din yun, pwede nyo kasing invert ang yellow tap, kaso wag vigorously kasi baka mag-hemolyze. So, konti lang siguro mga 2 to 3, pwede na yun. Usually, 5 to 10 minutes nagka-clot na yung blood. Kapag naman yung red tap lang, inaabot minsan ng 1 hour before mag-clot yung specimen, lalo na pag hindi mo in-invert. Pwede mo kasi siyang in-invert din, kasi may glass siya, na glass serves as the clotting factor. Next, arterial blood. So, obtained by arterial puncture, oxygenated, uniform in composition throughout the body, since siya ipapump pa lang from the heart. And specimen of choice for blood gas analysis. Blood gas analysis. Blood gas analysis. Doon siya malimit ginagamit. Capillary blood obtained by skin puncture, mixture of venous and arterial blood, and may contain tissue fluids. So, capillary blood is suitable in pediatric patients, obese individuals, yung hindi mo na talaga makita yung ugat, pediatric with thrombotic tendencies, and severe burns. Specimen collection. Una, venipuncture. Blood is obtained from a vein. So, median cubital. Preferred site for venipuncture, largest and best anchored. So, alam nyo na yan, ha? Cephalic, second choice. So, may to the right, sa right hand, to the right ng median cubital. If kaliwang kamay naman, edi to the left, yung outside part na ugat natin. Basilic, third choice, close to the brachial artery and usually associated siya sa mas masakit pag sa basilic ka kumuha. Precautions. So, selection of site. Sites adjacent to IV therapy must be avoided. So, kapag may swero, bawal kumuha doon. IV fluid contamination causes the following. So, kapag kumuha ka sa braso or sa kamay na may swero, nataas ang glucose, chloride, potassium, and sodium. Kasi may contents na ganito ang mga swero. So, 10% contamination with 5% dextrose, glucose increases up to 500 mg per dl. So, erroneous na agad, mali na agad yung inyong results na may bibigay from the extraction pa lang. Decrease in urea and creatinine kasi pwedeng ma-dilute ng inyong swero. So, bawal or wag na kayo mag-attempt kumuha sa may running na IV. Pwede ka naman kumuha below sa swero. Halimbawa, nasa braso na dito sa ating pinagkukunan ng dugo. Pwede ka mag-extract ng blood from the hand ng same kamay. Sa kamay, mas mababa. Since wala pa dun yung flow ng IV, pero madami pa rin tayong ginagawa. Papapatay mo muna yung swero. Mga 5 minutes to 10 minutes. Then, magpa-flush ka muna or magdi-discard ka ng sample. Usually 5 ml, yung first 5 ml na extraction mo, i-discard mo yon. Paano ka makapag-discard ng 5 ml? Usually, gumagamit na tayo ng vacutainer or yung evacuated tubes, yung vacuum tubes na para madali mag-discard. Ang discard tube natin is yun na lang red top. So, mga dalawang red top saka pa mag-extract ng blood. So, pwede sa mas mababa ng swero kapag pinapatay mo na din yung swero para sure. Tourniquet application. So, pressure is 60 mm of hydrogen. Tourniquet too close to the site, vein collapses kapag masyadong malapit. So, must be applied only within 1 minute to avoid hemoconcentration. So, ito talagang pressure is bini-BP then yung average ng BP. Yun yung ideal. Pero since hassle kung mag-BP pa tayo, saka pa kukunin, yung tourniquet na lang. Pero too tight tourniquet application, magko-collapse or hindi rin makakapag-flow ng tama yung ating arterial veins. So, hindi din makapagbigay ng blood. Mag-vein collapse din yun. Or yung ating veins, magko-collapse din. Disinfection. So, no traces of alcohol should remain. Alcohol causes hemolysis and contamination of the specimen. Kapag ethanol testing or ethanol yung test ng patient, use benzalkonium chloride or Zephyran for skin disinfection. Next, blood culture. 70% alcohol followed by iodophor. If allergic to iodophor use, chlorhexidine gluconate. So, dapat sterile na or nilinis na natin yung area. So, 70% alcohol pang tanggal ng debris. Then, yung iodophor, yung iodine, pang patay ng germs kung ano mang meron dun na makakontaminant doon sa ating blood sample. Pwede din naman na betadine, alcohol betadine. Basta dapat parehong meron. Dahil iodine yung pinaka-last. So, usually ginagawa nga betadine, alcohol, betadine. Venipuncture pa rin. So, needles. So, needles natin have gauges. So, the gauge is inversely related to the size of the needle. Paglaki ng gauge, pagliit ng needle. Pagliit ng gauge, paglaki ng needle. So, 21 gauge, color green to. Standard size. 21 gauge, standard size, 1 to 1.5 inches. 23 for children and smaller veins. 25 yung pink na yung pinakamaliit na nagagamit natin. Premature infants, 1 to 1.5 to 3/4 inches. Increased chance of hemolysis kasi maliit na yung bore ng needle, mas mataas na yung chance na masira or mabasag yung mga veins, mga blood. So, dahan-dahan lang dapat. Paglaki ng gauge, pagliit ng needles. So, 21 yung color green, 23 blue, 25 yung pink ba yan or orange. So, tubes for blood collection. So, plain tubes, yung clotting time niya usually is 60 minutes. Kapag tubes with silica or clot activators, yun ang yellow top natin, clotting time is within 15 to 30 minutes. So, minsan may mabilis talaga mag-clot. So, usually 15 to 30 minutes. Never transfer blood collected in an additive tube into another additive tube. So, pag nandun na sa tube na may anticoagulants or may additives, bawal na siyang gamitin para sa iba. Contaminated na yung blood na yon. Yung red top or yung walang laman, pwede natin ilipat yon. Pero, dapat agad-agad na din kasi pwede mag-clot na din yon. So, halimbawa, nag-extract ka from vacutainer, tapos may red top ka, pwede mo siyang ilagay sa mga microtainer or maliit na EDTA, agad-agad din. After mo mag-extract, lipat mo na din agad. So, tubes containing gel are not used for immunologic testing and TDM as gel may interfere with immunologic reactions. So, kapag ka-immunology, yung ating testing, ang ginagamit is plain tubes or yung red top tubes. Sites to be avoided for venipuncture, IV lines, burnt or scar areas, hematoma, thrombosis, edematous or yung manas, arms at the site of mastectomy and AV shunt fistula. Mastectomy yung na inoperahan. Then AV shunt or yung fistula yung mga nagda-dialysis. Fractured limb, alam nga naman, nakabalot na yun, kukunan mo pa. Complications, infection. So low chances naman ito mga to, pero ito yung mga possible complications when you perform venipuncture. Infection, thrombosis. Thrombus is a clot. So, thrombus develops within the blood vessel. So, nagkaka-clot sa loob. Thrombophlebitis. So, inflammation of the veins accompanied by a clot caused by trauma in the cell wall. So, pwede mag-clot doon. So, ingat kayo. Hematoma, pooling of blood under the skin. Hematoma yung pasa. So, thrombosis, yung clot kasi pwede siyang mag-circulate sa patients or sa loob ng dugo. At pag minalas, pwede siya mag-cause ng stroke sa utak. Arterial puncture. So, blood is obtained from an artery. Used in blood gas analysis and pH measurement. Sample collection without tourniquet. So, hindi tayo nagamit ng tourniquet since arterial puncture is malakas na or may pressure na yung ating arteries. Hindi na kailangan nun. Kapa mo na yun pag kinuna mo talaga. So, preferred site, radial artery, dito sa ating may kamay. Brachial, sa may kinukunan natin ng dugo, sa braso. Femoral, scalp, sa ulo, umbilical. So, doctors na yung mga kumukuha dito sa tatlong to, usually. Femoral, scalp, and umbilical. Dito lang tayo, if ever mag-extra kayo. Radial and brachial. Allen's test or modified Allen's test. So, test for patency of ulnar and radius artery. Done before performing arterial puncture. So, i-check mo if kaya ng iyong ulnar artery kapag medyo na-damage mo muna yung radial artery. Habang kinukunan mo halimbawa, yung iyong patient, kinunan mo sa radial artery, syempre, maghihina muna yan kasi na-damage mo. So, titingnan mo kung kaya ng ulnar mag-provide ng blood sa iyong kamay. If hindi kasi, hindi pwedeng kunan yun, magkakaproblema yung kamay. Complications, bleeding. So, bleeding is harder to control compared to venous bleeding kasi may pressure nga yun. Yung ating veins, may pressure siya. So, possible mag-bleed pa yun compared sa ating venipuncture. So, apply pressure to the puncture site for 3 to 5 minutes. So, press nyo yung pinagkunan ng dugo. Siyempre, hindi naman pwedeng 5 minutes kayo nandun. Kapag may kasama na yung pasyente or yung pasyente ay gising, pwedeng siya na yung paghawakin mo nun. So, yun ang pag-press mo ng 2 to 5 minutes. Thrombosis, hemorrhage, and infection. So, same din. Kaya no, venipuncture. Next is skin puncture. So, done by finger stick technique. Preferred for children kasi mga malikot or manipis yung ugat. Length of lancet is 1.75 millimeters. Length of incision is less than 2 mm sa children. Cut should be oriented across the fingers to generate a large drop of blood. So, kapag kasi tumama ka ng perpendicular sa ating fingerprints, messy yung dugo. Major causes of sample interference. So, number 1, hemolysis. Hemolysis is caused by the destruction of RBCs. Pwede siyang due to in vitro or sa loob. Due to underlying disease or yung cells ay hemolyzed na sa loob pa lang bago lumabas. Hemolyzed na yung blood bago mo pa siya ma-extract. Inherent to the patient. So, patient yung may problema dito. In vivo, sa labas naman, may be due to RBC fragility, inappropriate venipuncture technique, or specimen contamination. So, using a small bore needle or engage 25, pulling the plunger too fast. So, hindi ka pa maganda yung pagkaka-insert ng needle sa ugat. Tapos, prasado ka pa sa paghigit ng plunger. So, ramdam mo yun, may force yun, may counter force yun na parang hinihigit yung plunger, tapos hinihigit mo pa din. Expressing the blood forcefully into the tube. So, yung pagsasalin mo, prasado. Vigorous shaking or mixing, kinalog mo talaga. Alcohol contamination, so alcohol can cause hemolysis. And bubble formation. So, madalang naman ito, bubble formation. Okay lang yan. Effects of hemolysis, increased level of intracellular analytes like potassium. Dilution effect from the analytes present in the serum or plasma, sodium. Interference in color reactions, kasi medyo mag-pink or ma-red yung sample dito, yung serum natin. Mas mapula compared sa regular serum. Inhibition of certain analytes, so certain analytes affected kapag hemolyzed yung sample. Icterus. So, icterus is yellow discoloration of the plasma or serum. So, sobrang yellow talaga niya. Parang medyo nagba-bright yellow siya talaga or medyo orange yung sample. Inherent to the patient. So, again, patient yung may problema. Caused by increased bilirubins of greater than 20 mg per dl. Causes optical interferences by its high absorbance at 340 and 500 nanometers. So, pag 340 and 500 nanometers, nakaka-apekto ang icterus. Last is lipemia. So, lipemia is caused by high triglycerides level, usually greater than 400 mg per dl. Causes turbidity in the serum, which eventually blocks transmission of light. So, kapag bagong kain din ng matataba, crispy pata, sisig, dinakdakan, yun, ang nakakataas ng lipemia or ng lipids. Can be cleared from the plasma by ultracentrifugation, inherent to the patient. Again, sa patient, pwede siyang tanggalin by ultracentrifugation para madala yung hospital na may ultracentrifuge. Inhibits the following. So, ito yung mga naepektuhan ng lipemia. Amylase, urates, urea, creatinine kinase, bilirubin, and total protein. So, transport and storage naman tayo. Separation of serum or plasma as soon as possible. So, kapag clotted na siya, centrifuge muna. So, prevents movement of water into the cells resulting to hemoconcentration. Standing time, kapag plain tubes, 60 minutes. Kapag silica or yung may clot activator tayo, pwede na ang 30 minutes. Test, unstable if not removed from clot after 30 minutes. So, bawal na siya pag hindi mo agad na SART-3 within 30 minutes. Potassium, phosphorus, and glucose. Ito ay 30 minutes. Next is 6 hours. So, depende pa din ito sa test mo sa inyong machine. Kung ano yung nakalagay sa SOP nyo sa laboratory, yun ang susundin. So, test unstable after 6 hours if serum was not separated from the clot. Yung hindi mo pa siya ng centrifuge, bawal na itong mga to. Albumin, bicarbonate, chloride, C-peptide, HDL and LDL, iron, and total protein. So, yung ating centrifugation dapat 3,000 RCF for 10 minutes. Excessive centrifugation or yung sobrang centrifuge causes red cell lysis na hemolyze. Elevates LD and potassium. LD is lactose dehydrogenase, lactate dehydrogenase, which is an enzyme. Then yung ating potassium. So, under centrifugation, incomplete barrier formation, failure of cellular elements to settle. So, pwedeng interfere yung ating cellular elements. Serum or plasma must be stored at 4 to 6 degrees Celsius if analysis will be delayed for longer than 4 hours. So, to preserve the specimen, lalo kung hard to extract, mga 4 hours kasi usually yung ating stability ng sample. So, para kapag halimbawa may problema, hindi pa mararan or sira yung machine, i-store mo muna sa 4 to 6, so which is refrigerator temperature. Specimen that require chilling during transport and storage. So kapag ita-transfer mo o transport from one lab to another or kung malayo yung paglalagyan mo, dapat naka-ref to mga to. Ammonia, blood gases, catecholamines, gastrin, lactic acids, renin, PTH, parathyroid hormone, pyruvate, and lactic acid. So chilled dapat siya. So medyo malamig talaga dapat. Specimens that require protection from light. Meron tayong samples that are photosensitive or kapag nalagyan mo ng ilaw or nailawan, nasisira yung sample, hindi siya pwedeng for testing. So, dapat kinocoveran either amber container or carbon. So, paano ginagawa dito? Yung test tube natin, binabalutan ng carbon. So, bilirubin, beta-carotene, folate, porphyrins, vitamin A, and B6. Specimen of choice for lactic acid and glucose monitoring. Sodium fluoride and potassium oxalate as anticoagulant. So lactic acid must be kept on ice, naka-yellow, and separated from cells as soon as possible. So dapat i-center mo na agad. Acid phosphatase, serum must be separated as soon as possible and buffered with citric acid. Kapag ammonia determination, heparinized plasma, kept from ice, separated cells and performed immediately. Lactate dehydrogenase isoenzymes. So serum, store at room temperature, do not refrigerate or freeze. Kasi meron diyang cold labile na isoenzyme or yung fraction ng LD, yung ibang isoenzymes niya nasisira pag nilagay mo sa malamig. Ionized calcium, heparinized whole blood, must be collected anaerobically and kept on ice. Kailangan din ma-process agad to kasi nawawala yung ionized calcium. Nag-evaporate siya pag inopen mo. So, anaerobically talaga dapat. Vacutainer kapag pwede. Blood gases. So, heparinized whole blood, drawn anaerobically and kept on ice. So, yun lang. Thank you.